Hello everyone. Today I'm going through the chapter integumentary system, and I will describe some topics with some examples along with the calculations. This chapter is really very important as there are some calculations which are very tricky. If you are new to this channel, please like and subscribe. Alright, let's get started. Integumentary system. The integumentary system subsection of the CPT codebook includes the following body parts. The first one is skin and subcutaneous structures, including the excision of the skin lesion, wound closure, skin grafting, burn treatment, Mohs chemosurgery, incision and drainage, and debridement. The next one is nails, including the debridement, excision, and reconstruction of the nail beds. Another one is the breast, including needle, incisional, and excisional biopsies, and all type of mastectomies. This is the anatomy of the skin layer, and it has the layers like epidermis, and underneath the epidermis there is a dermis, and under the dermis there is hypodermis, which is also called subcutaneous or subcu, and underneath the hypodermis there is fascia or muscle. And this picture helps to understand where each of these layers lies. Debridement. Wound debridement is a surgical method in which a patient's dead, damaged, or infected tissue is removed to assess the healing process. The code for this type of procedure are differentiated by the depth, which can be subcutaneous, muscles, or bone, size of the debridement. For a single wound, report the depth using the deepest level of the tissue removed. For multiple wounds, sum the surface area that are at the same depth. Do not combine some from the different depth. Debridement examples. The first one is the physician debrided 3 square centimeter wounds of the buttocks in the muscle, and another 4 centimeter square wounds in the muscle of the heel. So here the wounds are at the same depth, which is the muscle. So we can sum the dimension, that is the 3 square centimeter plus 4 square centimeter, which would be 7 square centimeter. So here are the options for these questions, and these are the description of the code. So option A has the description of the subcutaneous tissue, option B has bone, option C has skin and subcutaneous tissue, and option D has muscle. Our question is talking about the debridement of the muscle, so we will go to the option D, which is debridement muscle or fascia, including epidermis, dermis, or subcutaneous, if performed, first 20 square centimeter or less. This is the answer, and it's because the answer is 7 square centimeter, which is less than 20 square centimeter. Option D is the correct answer. The next example is the physician debrided a 3 square centimeter wound of the buttocks in the muscle and another 4 square centimeter in the bone of the heel. So here the depth is the muscle and the bone. So the options are the first option A has the highlighted part is the muscle and bone. Option B has muscle. Option C has bone. Option D has subcutaneous tissue. Our question is talking about the muscle and the bone, which should be option A, debridement muscle first 20 square centimeter or less, and debridement bone, which is for the first 20 square centimeter or less. Lesion. During surgery, physician may take some normal-looking skin around the growth. Removal of the normal-looking skin is known as taking margin. This is done to be sure no cancer cells are left behind. The total size of the excised area, including margin, is needed for accurate coding. If the lesion is irregular, the maximum width is used to measure the lesion. When more than one dimension for an excised area is provided, the size is equal to the largest dimension of the excision, including the margin. So if for example, if the question is talking about the margin of 1 centimeter, we have to take the margin on both side, which we can say left or right side, just to remember, because margin we need two sides total. So if it says margin of 1 centimeter, it should be 1 centimeter plus 1 centimeter, which is 2 centimeter total. So we will go through more examples that is related to the margins in the following slides, and we can see some more. Lesion examples. Excision of 1 centimeter times 2 centimeter lesion of the hand would be assigned with which code? These are the options, and these are the description of the code. So option A has the highlighted part is hand. Option B has face, ear, eyelid, and nose. Option C has hand, and option D has hand as well. We can ignore the option B. So the first, so we will take the take the greatest dimension, which is 2 centimeter. According to the question, the 2 centimeter is the greatest dimension. So we will go with option A, that is excision benign lesion including margin, scalp, neck, hand, feet. Excised diameter is 1.1 to 2 centimeter. Our question, we have to take 2 centimeter according to our questions, which is the largest width, the largest dimension, and that is in option A. Option A is the correct code. Another example of lesion, excision of malignant melanoma of the left arm, 3 centimeter times 1.5 centimeter with 1 centimeter margin surrounding the lesion. These are the options, and these are the descriptions. Option A is talking about the arm. Option B is talking about the neck, hand, which our question is talking about the arm. So we will ignore the option B. Option C is talking about the arm. Option D has neck and hand. So we will ignore B and D. So we will consider for now option A and option C. So from 3 centimeter times 1.5 centimeter dimension, we will take the largest dimension, which is 3 centimeter. And from the margin, we will take 1 centimeter plus 1 centimeter. So we will take in both sides, which is total margin is 2 centimeter. So 3 centimeter plus 2 centimeter is 5 centimeter. So we have to. So the option is the answer is option C, which is the excision malignant lesion arms, excised diameter over 4 centimeter, because our answer was 5 centimeter, which is 3 plus 1 plus 1 was 5 centimeter. So it's option C is the correct answer. Another lesion example is the physician excised malignant melanoma of the back that was reported as 3 centimeter times 2 centimeter. Documentation in the operative report states that 0.5 centimeter margin was excised around the lesion. The correct code assignment would be options, and the description and the highlighted part are the important points that we need to consider when we select the options. So the first option A is talking about the trunks, arms, or legs, and our question is talking about the back, which is a trunk. And option B has scalp, neck, hand, and feet. We will ignore this option. Option C has trunk, which we needed, and option D doesn't have trunk. So we will consider A and C for now. And according to the questions, let's do the calculation now. The largest dimension is 3 centimeter. And the margin is 0.5, and now we'll take the total margin, which is 0.5 plus 0.5, so it's 1 centimeter total margin, and 3 centimeter the largest dimension, that is 3 plus 1 is 4 centimeter. So the option is option A is the correct answer. Excision malignant lesion including margin, trunk, arms, or legs, excised diameter is 3.1 to 4 centimeter. Our answer was 4 centimeter. 3 plus 0.5 plus 0.5 was 4. So this is the correct answer. Another question is, if the documentation stated that the melanoma skin lesion was 1 centimeter in diameter and required wide excision of 0.3 centimeter margin on each side, the code assignment would be the options and the descriptions. So it should be the 1 centimeter diameter plus 0.3 centimeter plus 0.3 centimeter margin. The total is 0.6 centimeter total margin and 1 centimeter diameter. So 1 plus 0.3 plus 0.3 is 1.6. Answer is option A, excision malignant lesion including margin, trunk, arms, or legs. Excised diameter is 1.1 to 2 centimeter. Our answer was 1.6, which is this answer. Wound repair: when multiple wounds are repaired, the length of those in the same classification and from all anatomic sites are grouped together into the same code description. For example, add together the lengths of intermediate repair to the trunks and extremities. Do not add lengths or of repair from different groupings of anatomic sites. For example, face and extremities. Do not add together the lengths of different classification, for example, intermediate and the complex repair. When more than one classification of wound is repaired, the most complicated repair is listed first, followed by the less complicated repair. Types of wound repair or types of wound closure. There's 3 types of wound repair: simple repair, intermediate repair, and complex repair. So in simple repair, the wound is superficial. It involves epidermis or dermis or subcutaneous tissue, and it requires one layer closure. Intermediate repair, it involves subcutaneous tissue and superficial fascia. It requires layered closure. And complex repair involves bone, cartilage, and tendons. Wound repair example: a physician was treated for multiple wounds of the right forearm, hand, and knee. The physician sutured the following: simple repair 2.5 centimeter forearm, intermediate repair 1.5 centimeter hand, simple repair 2 centimeter knees. CPT code for this question. So the answer would be two codes, because there is a description about the intermediate repair and there is a description about the simple repair. So we're going to add all the intermediate in one code, and we're going to add all the simple repair in one code. So and also we will code from the complex to the simple. So we're going to start from the intermediate, which is only 1.5 centimeter of the hand. So 12041 wound repair hands intermediate 2.5 centimeter or less. Our question has 1.5 centimeter, which is 2.5 centimeter or less. Another code is 12002 wound repair arms and leg simple 2.6 to 7.5 centimeter. Our answer will be, when we add 2 simple, which is 2.5 centimeter of forearm and 2 centimeter of knees, it will be 4.5 centimeter, which is within that range. Another wound repair example is intermediate layered closure of 2 centimeter laceration of the right forearm and the intermediate closure of the 2.5 centimeter laceration of the left elbow. CPT code. So there will be one CPT code. It's 12032 wound repair arms intermediate 2.6 centimeter to 7.5 centimeter, because we can add, because it's the intermediate closure, both are intermediate. So we're gonna add 2 plus 2.5, which is 4.5. So there is one code, and for this code we do not worry about like left elbow and right forearm according to the questions. So the note is anatomic modifier like left and right are not appropriate for skin repair. Thank you for watching this video. Hope you learned something new today. Don't forget to like and subscribe, and I'll see you guys in the next video. Thank you.